The Commission for the Cultural, Religious and Linguistic Communities says it is through collaborative efforts between indigenous and Western methods that a cure or vaccine for COVID-19 can be found. The CRL has appealed to South African and international scientists, doctors, as well as traditional health practitioners to do everything possible to coordinate their efforts in finding a vaccine and a cure for COVID-19. Currently, there are 15,515 COVID-19 cases in South Africa with 264 deaths. Now to discuss this further, we're joined via Skype by CRL chairperson, Professor David Mosoma. Thank you so very much, Prof, for joining us here on SABC News.
And thank you very much to you and to your viewers.
Just as a start, I find it quite interesting that you've called for a collaborative effort to find a cure or a vaccine for COVID-19. Talk to us about whom you're wanting to see collaborate and how you hope to see this happening. Because generally, if one group thinks one way, the other group thinks another way. And generally, it would be quite difficult to get them to collaborate. So how do you sort of see this collaboration happening, Prof?
Thank you so much. I think the President has highlighted the high-level international and continental collaboration, which I think is very, very important. But we as a Commission, given our mandate, which is to protect the rights of cultural, religious and linguistic communities, and on the part of culture, part of that protection means also to promote the indigenous, what we call the diminished and diminishing heritages. And the diminishing heritages has to do with our own medicinal experiences. And this has been being on the backbone because the capitalism, the oppressive systems, colonialism and so forth have really not nurtured this area of African traditional herbal medicine experience and knowledge.
Yeah.
So we are saying to start off with, let's look at what we can harness inside South Africa, given the endowments of our own medicinal plants, and call upon the stakeholders, which means our health practitioners, our scientists, our researchers, including the African traditional health practitioners across the board. And this collaboration will, in our view, unleash the potential that we have as a country to provide and to lead in the possibility of finding not only a cure for COVID-19, but for cures that may come after COVID-19.
Yeah.
But of course, the focus now is to try to find a cure for COVID-19.
Prof, of course, you're talking about traditional health practitioners. Are we at this point hearing anything from those traditional health practitioners about, possible herbal medicines that they may have? What are the conversations that are being had at this time? If you're saying that they should be involved in finding a possible cure or vaccine, that means that there are conversations and perhaps ideas that they have of how this can be approached. Are we hearing anything solid from the traditional health practitioners at this point?
What we hear, because this particular sector of community, it's part of the CRL community. We hear complaints of exclusion, complaints of marginalization, complaints of lack of a voice. So when people operate at that level, their view is that whatever they say cannot reach the important ears in the environment. So we are saying, as CRL, we need to facilitate that conversation. Some have cited some of the medicinal benefits arising out of the old experiences of how these herbs have been used and have been useful in potentially helping other people to recover. So our view is to begin this conversation. In fact, in the year 2000, the meeting of ministers, health ministers, took a resolution in this regard to try to facilitate the a possibility of research to obtain and to acquire medicinal benefits that are arising from our herbal systems in order to make sure that they are efficacious, they are of quality, and they are safe for our people. So we are underscoring that. And even the WHO Africa Regional Committee underscored the importance of this collaboration. Yeah. We are saying almost many years down the line, the time has come. It is an opportune moment for this collaboration to take effect in our country and beyond.
Interestingly, Prof, you say that, but the WHO, has been pushing quite a bit for a vaccine, clinical sort of tested vaccine. And on the other hand, seemingly quite skeptical about other efforts. I mean, there were some international reporters asking about that medicine coming from Madagascar, for example, and it seemed as though they weren't necessarily keen at looking into it, but did say that it would have to be tested and so forth. But what you get a sense from WHO is that they are pushing for that vaccine. You have not heard very much about those sort of collaborative efforts. What are your thoughts on this, Prof?
Our view, when we listen to the statement from the World Health Organization, is not a rejection. It is the fact that the medicine that is being touted has not been tested for efficacy, quality, and safety. I think that is the point. So that collaboration will address these issues, all of them, without marginalizing others, hoping that a cure will come from elsewhere. And we are calling for mobilization of our intellectual arsenal across the board to achieve what we consider to be a medicinal benefit for our country and beyond.
All right, Prof, from the Commission for the Cultural, Religious and Linguistic Communities, CRL, chairperson, of course, there, Professor David Mosoma. Thank you so very much for giving us your time, sir. We appreciate it. Thank you.
Thank you so much.